So, welcome to British OET Training Centre. With me here is the academic manager, Hamid Sharif, and we're talking about OET. So, welcome, Hamid. Okay, right. So, I've got some questions here that were sent to us since we started telling people that we've got OET Preparation Centre now. And well, the first obvious question is, what is OET?
Actually, OET is a proficiency test which aims at proving that you as a doctor or as a nurse or a pharmacist have the necessary language skills to communicate in the language atmosphere in the workplace, specifically in hospitals, pharmacies, and so on. Okay.
And what does it stand for?
Occupational English test, and it's very specific to physicians, healthcare professions, just like medicine, pharmacy, nursery, and so on.
Okay, wonderful. So you're telling me that doctors should be interested, pharmacists should be interested, and nurses as well.
Exactly. Yes.
Okay, wonderful. So a second question is here. What are the course details? What is it about? People know about the IELTS, they know about the TOEFL, but nobody knows a lot about OET.
Actually, OET as an exam is very similar to the IELTS. It has four very different sections like reading, listening, speaking, and writing. However, they are very specific to the genre it's targeting. Like it's very specific to the healthcare workplace. The writing is like a case note, and you have to summarize it or refer to another doctor. Speaking is actually like a role play that you will be having with a patient. So you can assess your ability to communicate, prescribe medications, and so on. Reading and listening are also very specific to the healthcare atmosphere, but they are not specific to a profession. They are for everybody. Like if you are a nurse, if you are a doctor, you will have the same listening or reading exam. So it's basically the same. Mm-hmm. So this is the division of the test.
So what you're telling me now is that the context in the exam is all about, physicians, doctors,
exactly,
hospitals, and all that stuff.
Exactly.
Right. So now another important question is, when should a doctor feel that he or she can join OET? And I'm talking here about the levels, because people keep asking, if I am A2, if I'm A1, can I join the OET preparation? Which levels are required?
Actually, let's first differentiate between the OET test and the OET preparation course. To join the course, the preparation course that we provide at British OET, you should at least be of intermediate level. So you can get the score you want, which is basically B in the exam, so you can travel or work in another country. If your level is A1, A2, or B1, you should start first improving your English language through general courses and so on, then you can join the preparation course. This doesn't mean that you can't join the preparation course, you still can, but you might not be able to get the required score in such a short period because the course is 30 hours. It aims at improving your strategies, techniques, and sometimes your language in passing the exam. It doesn't work on improving your proficiency at all. You will need more time.
Okay, well here is a very important question. Now we say that we open a preparation course for students at the intermediate level.
Yes,
right?
exactly.
We agree on that. Now, what if someone who is lower than the intermediate level came to the center and said, hey, I need to take the OET preparation, there is no escape, I have to attend this course?
Actually, there are two solutions. First, you will join the 30-hour course that we provide, and then we'll give you extra support and guidance for other materials to follow at home. Or you can increase, or we can increase the number of hours on the course. Instead of 30 hours, it might be around 70 hours, because the lower the level, the more hours you need.
Wonderful, well that makes sense. Yeah. Right, okay, so now a very important question is, why British OET? Why would people think of British OET as a good place for joining the OET preparation course?
Actually, if anyone searches the OET website, you will find that British OET is the only course provider in Egypt, which means we have been through a hard process to be accredited as a preparation course. All the staff is well prepared to teach the course. They are not just English teachers. Most of them have been doing teacher training for some time. I have been doing teacher training for a lot of time, and I have taught OET, and I was an OET, speaking exam interlocutor for the OET themselves. Okay. So we know what we're doing. And also we are in the process of getting more materials that you wouldn't find in the market. It only exists in British OET to help you be more prepared with more exams, authentic exams, so you can use to prepare yourself.
Wonderful, wonderful. Right, now, I believe that's the big question now. I know that a lot of people will keep asking this question. A lot of people already have asked me this question. Which is better, IELTS or OET, or they're different, or there's no comparison? What's the answer to this?
Actually, IELTS measures your ability to communicate in general life. It proves your proficiency in English language as a general language, not in the workplace. So if you're applying to immigrate as a doctor or work in the UK or Australia, you need to prove that you can communicate in the workplace, in a hospital. And this is where OET comes in. OET proves to the people that you are a good communicator, that you can talk to patients, that you can explain things, you can read case notes, you can decide on the correct medication, you can explain it to the patient in their terms or medical terms if possible. So OET and IELTS are both two separate things. If you are traveling, you will find that the requirements asks you to do the IELTS and the OET, not one of them. But if you have the OET, it might be a replacement.
Okay,
Yeah.
so what I understand from what you said now, that IELTS for doctors, nurses and pharmacists is not enough now.
It's not enough, no.
Okay, but OET can replace it.
OET can be enough. Yeah, it proves that you can communicate, you can read, listen, speak, and write, and it's about the workplace, so it's very much enough.
And in terms of traveling, how important is OET? Like in terms of immigration, does it really help?
Actually, you cannot immigrate without the OET. It's one of the requirements right now. You have to do the OET. And it's because it has an expiry date, like the IELTS, it's for 2 years. If it's expired, you have to do it again. So, which proves that it's a valid course, it's a valid exam, and you will not be able to travel without it.
Well, thank you very much, my friend, for the valuable information. Okay, and thank you so much for watching this video. We'll be waiting, okay, for doctors, pharmacists, nurses. You're absolutely welcome at British right now, the only OET preparation center in Egypt. Thank you so much, and see you again. Thank you.
Thank you.
Bye.